guys, and welcome back to my channel. My name is Bernice. If you're brand new to this channel, please go ahead and hit the subscribe button because this is a family, and I'm making a few videos which will be very educating to a lot of you guys out there. I said I was gonna make these videos on the various diseases, talking about them, but this past weekend I was unable to make a video because I was busy adulting. If you don't know what adulting means, here is the definition. Boom. So I was busy adulting. I was taking care of a few things in life, but I'm back to upload this video for you guys because I promised I was gonna do it. I was going to do that. A lot of comments on that video, my last video. If you don't know what I'm referring to, you should go check it out. I'm gonna link it here. You should go check it out. I'm not playing. Go check it out. Anyways, you should go check it out. That video, I got so much responses on it, so much in my inbox and like my personal message, and like people who have my number. Those are the people that are like getting back to me and like talking about this video, like, girl, you should keep doing this thing. Like, what? Okay, I'm not gonna fault you guys. Thank you guys for like letting me know that you guys want me to keep making these videos. You know, it's lit. I'm gonna keep informing those who need to be informed, and yeah, it's lit. This video is gonna be on BV and yeast infection. I'm gonna start with BV, bacterial vaginosis, because this is the most common vaginal infection that women will get. Did you know that? I thought it was yeast infection. Lo and behold, it is BV. BV is the most common infection that women will get. What is BV? BV is bacterial vaginosis. What is bacterial vaginosis? It's also known as Gardnerella. Yeah, Gardnerella. And this is basically, normally the vagina, there is good and there is bad bacteria. They coexist, and there's a perfect balance between both bacteria. Now, when the bad bacteria overgrows the good bacteria due to one reason or another, you then have bacterial vaginosis. And it presents itself in so many symptoms, okay? So I'm just going to go ahead and list you guys the symptoms that BV could come with. There's discharge. Most of the vaginal diseases will come with discharge, so that one is no news. And the normal vagina has discharge, but this one has excessive discharge, excessive thin discharge, which could be white, gray, or green. So excessive thin, white, gray, or green discharge. There is going to be a burning feeling when you pee. Not everybody will have every single one of these symptoms, so I'm just giving you all the symptoms that you could possibly experience. You could get just one. You could get just one symptom, or you could get all the symptoms in the book. So don't ignore any one of them. The hallmark sign for BV, however, is the fishy odor smell. Okay, if you go on YouTube, you will see so many videos of people saying, "Oh, how to get rid of the fishy odor smell." And like usually the YouTubers have like an underwear, they're holding it and it's like smelling like fishy odor smell. Okay, can we stop getting rid of the fishy odor smell from the root cause of the fishy odor smell? It is BV. A lot of you guys walking out here in the streets with BV, calling it fishy odor smell. You're using Summer Eve trying to wash it away, using all these douches and whatever trying to wash it away, just making it worse. BV is a real disease. Go to your doctor, get checked, and get a medication to fix it. Okay. The fishy odor smell is the whole thing. You cannot ignore it. The smell becomes intense when you work out, or it could become intense after sexual intercourse. So that smell is a thing. BV is not a yeast infection. A lot of people get this wrong. People have BV, it becomes itchy, or there's the burning feeling when you pee, and they go to the pharmacy and get the over-the-counter yeast infection medications and try to fix it. If you've tried that before, you know that it burns. I've never tried it, but a lot of research, when I was doing my research on these disease states, says if you use Monistat and you have BV instead of yeast infection, it's gonna burn. So if you're having a fishy odor smell or whatever, don't use Monistat. It is not a yeast infection, it is BV. Lactobacillus produces acid in the vagina. The vagina is supposed to stay at a lower pH. That's the healthy pH for the vagina. Now, if you have a depletion of lactobacillus in the vagina, then it becomes an alkaline environment, and that's where the bad bacteria thrives, and then you get a situation called BV. You are at higher risk of getting BV if you smoke, if you have a new sexual partner, or if you have multiple sexual partners back to back, if you douche. Douching is not a thing, ladies. Douching is not a thing. When you take that douching pump and spray water up your vagina, it can carry the bacteria, literally carry the bad bacteria, and send it even up higher to your cervix, and then it can cause PID. You don't want to do that. Anyways, some doctors will advise you that it's a thing to do. It's a very controversial topic. In school, they taught us that douching is never an option unless there are special circumstances, unless the benefits outweigh the risk. Just there's a bunch of unless. So I wouldn't just go for douching if I really don't have to. How is BV diagnosed? Besides the fishy smell, you still need to go to the doctor, usually a gynecologist, who will swab your inner vagina and then take the sample to the lab, and then they will, usually it's called potassium hydroxide whiff test. They'll do that, or they could actually put it under a microscope and then they'll see the predominance of the bad bacteria in the vaginal swab. Let's talk about treatment. You can treat BV with antibiotics. Mostly, first line is usually Flagyl or metronidazole, 500 milligrams. You take it twice a day for about 7 days. Could be 10. It depends on the doctor. Some doctors will also prescribe, along with Flagyl, the vaginal insertion Flagyl that you actually treat it topically in the vagina. So you like insert it at night and go to sleep and all that good stuff. It's not good. It's actually nasty. It sounds nasty. But anyways, that is the treatment for BV. There are other treatments in case you fail your first treatment. There is clindamycin, tetracycline, and ampicillin. It's important to know that with BV, some people will get BV right back. Usually in the first 3 months, you could get BV right back. So this has nothing to do with anything. It's just it's been studied that whenever you get BV, you treat it, it comes right back. We don't know why. Nobody really even ever understands what causes BV. Everything that I explained is just theories and from studies and from everything that they've been doing in the past. Risk of having untreated BV. So let's say you have this fishy odor. It's not affecting your life. You're not having itching or burning. So you're like, oh, well, it's just a fishy odor. I can spray the deodorant, the vaginal deodorant that they sell in the store nowadays, and I'll be fine. What will happen if you don't treat BV? You have an increased risk of contracting STDs and HIV. You are at higher risk because the virus thrives in that kind of environment, meaning your vagina is more basic or alkaline, like the pH is more basic or alkaline, and bacteria and viruses thrive in this kind of environment. So you are at a higher risk of contracting STDs and HIV if you have BV and you decide not to treat it. If you have BV and you already have HIV, you have a higher rate or a higher risk of transmitting the disease over to the next person. In pregnant women, if you don't treat BV, premature birth, low birth weight in babies, and just stuff like that, miscarriages, just complications, pregnancy complications. So if you have BV, usually I believe pregnant women will take the BV treatment if they're still in like less than the third trimester of their pregnancy. So BV is not a thing. We need to get it treated if it's diagnosed in a patient. Prevention. How do you prevent BV? Protected sex. Protected sex with a new partner, unless you all got tested, but you could still have BV from having unprotected sex with just one person. So the best way to prevent it, protected sex. Wash sex toys if you use those and don't share them. Have a balanced diet to maintain your body's acidity levels. And we all know this: wipe from front to back. Ladies, we learned this when we were like 5 years old. Wipe from front to back. Avoid soaps with like harsh chemicals and chemicals you can't pronounce, or don't use any soaps at all. Just use water to wash. That's all for BV. Hopefully I didn't forget anything on it. I believe I talked about everything about BV. You can get it even if you're not sexually active. You want to go to the doctor to get diagnosed with BV. BV is not yeast infection. The reason why you go to the doctor to get diagnosed for it is because other STDs like chlamydia and gonorrhea also present themselves with discharge and some of these symptoms that I listed. So you need to go to the hospital to make sure it is not anything else but BV. It's not terrible disease to have. A course of antibiotics can help you, will help you get rid of BV. So take care of yourself, ladies. Let's talk about yeast infection.